President now is calling out Senator Rand Paul, the lone GOP leader who has come out against the bill. You remember this tweet from yesterday. The president wrote this: Rand Paul is a friend of mine, but he is such a negative force when it comes to fixing health care. Graham Cassidy bill is great. It ends Obamacare. Joining us right now is Florida Congressman and Freedom Caucus member Ron DeSantis. And Congressman, it is good to see you. Thanks very much for joining us this morning.
Good morning.
We want to first ask you about the bill next week, but your thoughts on the devastation in Florida, anything to tell us in terms of the impact of all of these hurricanes?
Well, you know, Maria, it could have been a lot worse in Florida. The storm lost steam. There is some structural damage in places like the Florida Keys, Marco Island in southwest Florida. And then it kind of swept throughout the state. There's a lot of debris throughout the state. And then some of the water rose on our rivers, on the intercoastal. So you did have some areas that were flooded. But I think the damage that you add up in that is probably far outstripped by just the business losses, because what happened was half the state was out of power. So you didn't have the tourism. People weren't coming down to do vacationing. And then you go 2 or 3 days in some spots. Some people have gone a week without power. So if you're a small business, it makes it very difficult. So I think some of those under the surface effects that you don't necessarily see if you just tour a given area, I think those are probably the biggest losses from the storm for Florida.
That's a big impact, Congressman. We'll be watching the economy, which, of course, has been doing well up until now. Congressman, the Senate is expected to vote on this bill next week, the Graham Cassidy health care bill. Can it pass despite the opposition?
Well, I think it has to pass, Maria. They've promised for years that they would repeal and replace Obamacare. The House did a bill, which was, certainly not perfect, but at least a step in that direction. And the Senate failed miserably in July. And I think that was the low point for this Congress and probably one of the lowest points for Republicans, the way it failed. And then they cut out for a 5-week recess. So I think that this is clearly better than Obamacare. It really empowers the states to fashion solutions, and I think that would be good for a large number of states who really are suffering under Obamacare. And I think you got to give the president credit that we're at this point, because you remember in August, he was out there criticizing the Senate. He was railing on McConnell, saying, you guys just can't quit. You got to get this done. So he's never quit. And I think at this point, we have until September 30th to get a bill through the Senate. This seems to me to be the most, the livest option.
Yeah, today it might not be the Senate, right, Dagan? It might be Lisa Murkowski.
Right. It looks like it's going to fall down. It's going to fall on the shoulders of Lisa Murkowski because of among the 3 senators who voted against moving the earlier Senate bill forward was Murkowski, John McCain, and Susan Collins. Rand Paul has already said that he's not going to vote for it, even despite what we saw. So it's basically there's a lot of pressure on her. But it seems like with Mitch McConnell, he will bring it to a vote. But I want to ask the congressman. But what about if it gets? What about where you would stand on this bill, because it does a lot of the things that Republicans wanted to do. It's the employer and individual mandates are gone, the subsidies are gone, but there's a lot that people are being shamed about in this bill, starting with Jimmy Kimmel. So how many of your colleagues in the House would be on board with this?
Well, I could only speak for myself, but I'm not going to take my cues from any late-night comedians. I'm going to actually look at the bill. I'm very favorably inclined to it. I haven't read it all yet, but if you look at it, it's not as good as the bill the House passed on taxes and spending, because it repeals some small number of Obamacare taxes, a small number of the subsidies, but it basically keeps the rest of the taxes and spending and then block grants it to the state. So from a fiscal perspective, it's probably a step back from what had already passed. But from a health care perspective, I actually think that this could be much better for actually health care, because you're empowering states, you're letting them take these funds so that they can fashion reforms to their Medicaid program and to their individual insurance market. That has the prospect of lowering premiums if it's done right. So I think this could end up being, particularly in those states who understand the problems with Obamacare and are willing to try to institute reforms that will help consumers afford the coverage. I think it could be very good in terms of the health aspect.
And just to point out to the Democratic congressman from Rhode Island who was on this program yesterday, he said that it was an $800 billion tax cut for the rich. And in fact,
that was a lie.
And in fact, one of the only Obamacare taxes that gets repealed is on medical devices, which is borne ultimately by the patient, which was a job killer. So the investment taxes from Obamacare are actually still in that bill. So that whatever he was talking about, I have no idea.
No, there's so much misinformation about this, and there's been misinformation from the beginning. The media, I mean, I appreciate you guys pointing it out properly, but a lot of the media, they took a lot of these CBO numbers, ran with it, even though you peel the onion back one layer and you see that they're flawed assumptions. So yes, that is just absolutely not true. And the medical device tax, remember, that's a tax on gross revenue. So you have companies that aren't even profitable, they still get hit with it. That kills innovation in that industry. So there's a lot of Democrats who oppose the medical device tax for that reason.
Yeah, well, Cicilline came on yesterday, and he was making all of these claims as if we didn't know the bill, and we know it very well. And so we pushed back on him, but he's continuing the charade, I guess, online. Let me turn to the tax package, Congressman, because we are waiting on some details from the White House next week on a tax program. If it's a 20% corporate rate, if it's a 28% pass-through rate, if it's taking individual rates to 12, 25, and 35, would you vote for that package?
Well, I mean, I'd have to see what else is being done. But look, I mean, I would like to see a 15% business rate. 20%, though, I think would be very positive. I think it would be a big difference. I think it would totally reorder the incentives. I think we'd start to be a magnet for capital rather than repelling capital. In terms of the individual rates, I mean, obviously, I would prefer that to the current system. I would want to see what's being taken out of the tax code in terms of some of the clutter and whether you can actually file it on a postcard. But, I mean, that general outline, I think, to me, looks good. We got rid of the border adjustment tax, which I had said was probably the biggest impediment to tax reform. So now it's just a matter of, okay, we agree on a lot of the other stuff. Put it into a package. Let's actually generate a bill. We should have had a bill by now. We need to get a bill written soon so that it can be processed in the House and processed in the Senate. But what the Senate did with their budget talks, I think, is actually encouraging. They budgeted in, for some tax cuts, which is good. So they're not going to get hung up on quote unquote revenue neutrality. I think that gives you the freedom to really err on the side of being very pro-growth.
It sounds like you think we're going to get a bill and we're going to get this done by year end. Do you believe that to be true?
Well, I hope so. I think if we can get a bill soon, then you can do it. The longer this drags out,
of course,
then it just, so we got to get that bill written. And then once there's a bill written, everyone can have input. And I think everyone in the Republican side, we desperately want to get this done. So people are going to want to vote for this thing, but we got to see it.